Good afternoon, everyone. Thank you so much for joining us today. My name is Marissa Katz, and I'm a senior staff attorney at the Public Health Law Center. And I'm really looking forward to having today's panel discussion on the Navajo Nation's recently enacted tax law. For those who are unfamiliar, the Public Health Law Center is a nonprofit organization housed at the Mitchell-Hamlin School of Law in St. Paul, Minnesota, and located on the tribal and treaty homelands of the Dakota people. The land acknowledgement on this slide was developed by the Native American Law and Sovereignty Institute at Mitchell-Hamlin and is used here with permission. For more information on the Indigenous peoples in these tribal lands, we encourage you to visit the URL posted on this slide. So here at the center, we have four main programs comprising of commercial tobacco control, healthy eating and active living, climate justice, and public health infrastructure. We offer free legal technical assistance to communities, public health advocates, and other partners throughout the United States. We also publish on important issues pertaining to each of our program areas, as well as offer trainings and webinars. We do not, however, provide direct client representation, including giving legal advice or lobby elected officials. Health equity is centered in all of our work and is done with mindfulness of several factors that influence public health, including housing, education, the environment, and a variety of other social determinants. It's important that our policies seek to balance the goal of protecting the public from the harms of commercial tobacco, with knowledge that punitive measures against those who use these products are unlikely to help them in their struggle with nicotine addiction. So let's go ahead and get started. I'll kick us off with a very brief overview of commercial tobacco tax policy, including best practices to ensure the tax policy is an effective one. Then we'll spend the bulk of our time speaking with and learning from our panelists, all of whom played a part in the Navajo Nation's landmark tax legislation that was passed into law last November. And as we near the end of the webinar, we'll try to answer any questions you may have. So let us know what you're thinking, either in that Q&A box or using the chat feature. As a quick reminder that throughout today's webinar, we'll be referring to tobacco, its impacts, and regulation of its use, but want to clarify that this is in reference to industrial scale commercial tobacco production and not traditional tobacco, as it's still used religiously, medicinally, and ceremoniously in many different cultures. This slide contains two linked resources on traditional tobacco, which you should check out to learn more about its sacred use. So when we talk about commercial tobacco product taxation and its overall role in tobacco control policy, we know that increasing taxes on tobacco products is a highly effective public health intervention. Studies have consistently shown for many years now that higher tax on cigarettes in particular, but also for other tobacco products, increases the number of quit attempts by people addicted to these harmful products, while at the same time making initiation less likely among young people whom we know are particularly price sensitive. Increasing tobacco product taxes also increases government revenue, which can lead to additional public health benefits, especially if that revenue is dedicated to tobacco control efforts or other public health measures. The key takeaway is that tobacco product taxes are an important source of revenue at the local, state, tribal, and federal levels, and can be used to offset tobacco attributable healthcare expenditures that we know are imposed on governments down the road. The tobacco industry, of course, knows this all too well. They know that high tax rates on their products harm their bottom line. They acknowledge the public health benefit that results from tax hikes means a decrease in consumption. And you can see here from industry documents released during the tobacco litigation in the 1990s that their primary concern is that taxation depresses their product sales. And because of this fact, the industry has historically lobbied to keep taxes low by using consistent scare tactics and misleading arguments, primarily ones that center around economic harm, with some of these arguments even being made under the guise of social justice or other worthy causes. Examples of that include higher taxes on these products harm the poor, or higher taxes result in job loss, or higher taxes hamper the state's ability to bring in revenue, and so on. But remember, what we're dealing with are consumer products that harm both individual and public health. And the tobacco industry's playbook in downplaying these harms through their spurious claims of economic damage are ultimately unconvincing. And so it is then really incumbent upon governments to adopt and implement strong, comprehensive tax policies that will achieve the aim of both protecting public health as well as saving billions of dollars in healthcare expenditures. So how do governments accomplish this? It goes without saying that addressing all the public health best practices when it comes to taxing these products is a webinar in its own right. But for today, I'll just briefly provide some highlights. And first is to figure out what is defined and taxed as tobacco products. A clear definition of what is being taxed is essential, which requires that definitions be comprehensive so that the universe of products are captured. Ideally, including oral nicotine pouches and nicotine analog products as well into that tax structure ensures that consumers won't end up switching to products that are more affordable because those products end up being taxed at a lower rate or not taxed at all. At the same time, e-cigarette products are notoriously difficult to determine the appropriate type of tax to assess, and that's because these products continue to evolve and come in various forms, from refillable tank systems to single-use disposable products. An e-cigarette tax would therefore ideally come in the form of an ad valorem tax, which is based on the value of the product and usually a percentage of the wholesale price, and should include all e-liquid and functional parts and accessories at a rate that is on par with other commercial tobacco products. You also want to create a tax structure that systematically increases taxes on all tobacco and nicotine products, as well as anticipate how the industry will develop new products that are specifically designed to evade taxation and other forms of regulation. And finally, if possible, it's important to direct allocation of revenue for universally accessible, culturally tailored cessation programs and to other commercial tobacco prevention and control programs. So for the rest of our webinar, we're going to learn more specifically about the Navajo Nation's landmark tax law. I'll just say at the outset that the historical impact of tribes on the commercialization of sacred tobacco over the years cannot be overstated. Tobacco control laws at the federal, state, and local levels continue to affect tribal nations to this day. And because tribes are exempt from state taxation on commercial tobacco, these products tend to be more accessible to Native populations, which increases usage disparities among American Indians and Alaska Natives. The Navajo Nation's commercial tobacco tax law, therefore, represents a significant victory in Indian country and sets a great example for other tribal communities, as well as for state governments, when it comes to supporting tribal sovereignty and building those positive relationships between tribal nations and states. So we have an excellent panel for you today. Herschel Clark is a citizen of the Navajo Nation. He received his Bachelor of Science degree in American Indian Studies from Arizona State University and earned his Master's in Public Health degree from the University of Arizona. He's currently the program supervisor for the Southwest Navajo Tobacco Education Prevention Project, a nonprofit organization that addresses tobacco control and prevention efforts in the Navajo Nation. He's worked in tobacco control and prevention for the past 10 years as a public health researcher, advocate, and advisor. He helped lead the passing of the Navajo Nation's Heirs Life Act of 2021, a comprehensive commercial tobacco smoke-free policy. And of course, he led the passing of what's the subject of today's webinar, the Navajo Nation's tax increase on all commercial tobacco products, including e-cigarettes, vaping, and nicotine products. Herschel understands the use of ceremonial tobacco is sacred for many indigenous tribes and must be protected, preserved, and reclaimed through both Western science and indigenous worldviews. Next, we have Ann Boone, who's the director of U.S. research at Campaign for Tobacco-Free Kids, a leading advocacy organization working to reduce tobacco use and its deadly consequences in the United States and around the world. Ann primarily provides support and technical assistance on federal, state, and local tobacco tax issues, including developing projections on the public health and economic benefits of tobacco tax increases. And last, but certainly not least, is Colin Welker, my colleague, who's a senior policy analyst with the Public Health Law Center's Commercial Tobacco Control Program. Before joining PHLC, Colin worked for the American Indian Cancer Foundation and the Sault Ste. Marie Tribe of Chippewa Indians. In both positions, he worked to advance policy systems and environmental changes for Native communities across the country, focusing on commercial tobacco policy initiatives. Colin also served as a fellow from 2015 to 2017 with Truth Initiative, where he advocated for progressive policies for protecting LGBTQ youth from the tobacco industry. So welcome to you all, and thank you so much for being here today. And I think to get us started, I'm going to start with you, Herschel, and set the stage for us, if you would, and tell us a little bit about the Navajo Nation, its government structure, maybe how legislation gets passed, as well as giving us a little bit of background information on the Heirs Life Coalition.
Yeah, thank you, Marissa. Thank you for the introduction, and thank you for the background. I think that a lot of the information you shared is really good for the audience. My name is Herschel Walker Clark. Like Marissa introduced myself, so I don't have to introduce myself. But a little bit about Navajo Nation. I think a lot of our people do know that Navajo Nation is one of the federally recognized tribes throughout Indian country, and we're one of the largest land base in regards to when it comes to Indian tribal tribes and throughout Indian country. And we're located here in the Southwest between three states, Utah, New Mexico, and Arizona. And a little bit about the structure of it. We're a three-branch government system, kind of very similar to the United States, where we have a president, executive office, then we have the judicial, then we have the legislators, which is our Navajo Nation Council, who we really work closely with in regards to how the policy is developed on the Navajo Nation. And just a little bit about it, it's really, comes down from the grassroots is really where it comes from. Then it goes to the local leadership. We have about 110 chapters on the Navajo Nation, and those are considered to be like townhouses. You would consider them to be cities in regards to like how a state would do. But there's 110 chapters. There's 5 agencies we work with throughout those structured systems on the local level. We got to go through that kind of process for a policy to be passed. We introduced it at the local level, and it goes on to the Navajo Nation Council. And the council has about 5 different committees that it has to go through, and then eventually, when it does get passed to the Navajo Nation Council, it goes to the Navajo Nation President for him to sign it. So that's kind of like briefly how the process is. And I think I learned about this through the experience of the work that we do in tobacco control. Our office, the Southwest Navajo Tobacco Education Prevention Project, we've been here for almost 20 years now. We were kind of reflecting back that our office opened back up in 2005. And it really started off with the grassroots efforts of the Team Navajo Health Coalition. They were really the ones that laid down the grounds, the foundation for us to really understand how to go about policy development for the Navajo Nation. Just the numerous attempts that they've done historically. I think there was about 6 attempts, including one in People's Initiative. So I think through that work, it was very successful. And you mentioned the Heirs Life Health Act that was passed in 2021. I think that was the milestone of our achievements and the work that we've done. And you guys all been part of that, campaigns, public health law, so many partners that have been part of that whole process. And I think that really resonates like who we are as a coalition. We used to be called, well, there still is the Team Health Coalition that really laid down the foundation, but it was back in 2017, we changed the name because the students, we really wanted to focus with the kids, and the kids really earmarked the phrase Heirs Life. So we kind of adopted that when we passed the Heirs Life Health Coalition or Heirs Life policy in 2021. So it was really a reflection of the youth really having their voice in it, and it kind of mimicked Water is Life. I think there was a huge movement with that too over in Standing Rock. So we kind of earmark that as our coalition, as Heirs Life, the work that we do with commercial tobacco. So that's kind of like our background of our coalition. We've been really instrumental with public health advocates for sure, but also the grassroots organizations in the communities. We have youth involvement. We have tribal leaders involvement as well. Then we really try to work with our traditional healer organizations on the Navajo Nation. And I think that really kind of elevated our work that we do to really try to advocate for their input on how they look at policy development and how they look at earmarking these funds. And I'll explain a little more about the legislation that we passed with the tax increase and how those funds are being earmarked with the traditional healers input on that too as well. So it's really been a really unique kind of efforts and works that we do in our office, and it's just really been a journey for me too as well in public health. Like my background is not in public health; it really was American in studies. So it really gave me an understanding of what it means by being a public health professional too as well. But I don't want to go on and on, but I think I answered your question, so I'll leave it open for.
No, thank you. And I think that's such an important point to make about really just all of this. The genesis of all of this is to have those collaborations with youth leaders, tribal leaders, as you said, and then also with the external partners as well, which leads me to a question that I've got for Colin about Public Health Law Center's history working with the Heirs Life Coalition. And maybe you, Colin, if you could speak to that partnership and including maybe some previous success stories that led up to the tax legislation.
Sure. Thanks, Marissa. Thanks everyone for being here as well. I just want to start by saying we're so grateful to be a partner of Navajo Nation as a public health leader in Indian country. I think I speak for all of your partners at Tobacco Free Kids and all those organizations. We're so happy to help you all out as best we can. But PHLC, I mean, long before I came on board 5 years ago, had been working with Navajo Nation on various policies, I think going back over 15 years. Particularly, Herschel mentioned several attempts on passing various legislation, but we had helped, among others, provide language and drafting of language for that Heirs Life legislation that passed in 2021. Again, just want to reiterate that through the process, though, we partnered with not only Navajo Nation, but organizations like Campaign for Tobacco Free Kids, American Non-Smokers Rights Foundation, American Heart Association. There's been so many people involved. So I think that's just kind of the theme I saw recurring as I was reflecting on preparing for today's presentation, is that there was a lot of folks involved and we were there for a long time. So we know these things take time. But I think one thing I wanted to highlight is just that success that Herschel and team, Dr. Henderson, had when passing the Heirs Life legislation really led to a successful campaign to pass this tax legislation, which we'll talk more about the details. They were able to celebrate that win with the Heirs Life legislation, but not long after, they reached out to these partners, myself and Anne's team at Tobacco Free Kids. I think Claudia Rodas was very involved at Tobacco Free Kids. So like I said, not long after, we got an email from them saying, hey, we're ready to press forward working on this tax legislation. And so I think that was a really a good idea on their part, and they were prepared because we had been working there, had some of this language drafted years previously, but the time was right to pursue this tax legislation. And I think just they played into the momentum that they had gained from that Heirs Life legislation. But it really speaks to the importance of having a strong coalition when doing this work and utilizing each of our areas of expertise. So, yeah.
Yeah, thanks, Colin.
Has anything to add? Yeah, thanks.
I think, yeah, I think that's a great history and background to sort of like lay the foundation or setting the scene for how the tax legislation got started and moving forward. And Anne, I'll turn it over to you now, just so feel free also to kind of speak to the history of the Campaign for Tobacco Free Kids involvement with the Heirs Life Coalition. But I'll also turn to you to kind of kick us off and get us started on just addressing those key provisions or relevant provisions that we want to highlight today of the Navajo Nation's tax law itself, including the tax rates and anything else that you wanted to touch upon with that.
Great, thank you. And thanks again for inviting me to participate in today's call. Just as Colin had said, we felt very honored to support the Navajo Nation in their efforts to increase tobacco taxes this or last year, I guess. But the campaign has been involved with working with the Navajo Nation for years now. I mean, I remember my first year working at the campaign. I ran some projections for a potential cigarette tax increase for Dr. Henderson way back in 2007. So we've been at it for a long time, and we've been honored to partner with them and others on their efforts. So since then, we provided technical assistance on a variety of other issues. Again, as Colin had mentioned, we were part of the coalition to work on the Air is Life smoke-free campaign. And every few years we've been asked to run projections for another tax increase. And so we've been ready for this. I think the Navajo Nation, Dr. Henderson and her team and Herschel have really been priming leadership there to consider a cigarette tax or tobacco tax increase. And so every few years we've been running projections. And so this is the year or last year was really the year that it kind of took off. And so, as I had mentioned, we've really been trying to be a resource for technical support for Dr. Henderson, Herschel, and the others. And whenever they've had questions from leadership, we've always been there to try to help them work through some of the questions that they've been getting. So they really knew what needed to get this passed in terms of, the actual process, but also in terms of answering the specific questions that they were getting. And so we were just happy to be there to provide fact sheets or information from other places that could help support the need for a tobacco tax increase. And we look forward to working with them on other issues going forward. And so I just wanted to give a quick example. If I have 2 slides. So my first slide, if that could pop up real quick. So I just wanted to give an example of some of the support that we did provide. We shared our projections. We have a tax model that we work with the American Cancer Society Cancer Action Network, as well as Tobacconomics, which is now known as Economics for Health. And so we have this model that we update every year. And with the data that was specific to the Navajo Nation in terms of prevalence, population, and all that, we were able to run some projections on the benefits of a $1.50 tax increase in the cigarette tax. The numbers are blacked out, so we tend to not like to distribute our numbers after a tax increase has been passed. A lot of factors go into declines in use and stuff like that, and so we just don't want those numbers to be out there to sort of provide fuel for the industry to claim that this tax increase didn't work or whatever. So anyway, this is an example of the type of projections that we put out and that we provided to the team over there so that they could have the support that they needed to show that a tax increase would have a significant public health benefit. And then I just wanted to go through and talk about some of the changes in the taxes. So next slide, please. Thank you. So this slide shows the old and the new tax rates. We were very fortunate to be able to push and get past a $1.50 tax increase. And, that is a significant tax increase in the cigarette tax. But in addition to that, what we found was, really important, as Marissa had mentioned, is the importance of increasing the tax on other tobacco products as well. Again, we don't want certain products to be cheaper or more affordable, particularly for youth, so that they might start using those products instead. And so we really worked with the Navajo Nation, the leadership, Herschel and Dr. Henderson, to emphasize the importance of making sure that all these other tobacco taxes are increased as well. And so you can see that these were very significant increases. So not only, again, a $1.50 tax increase in the cigarette tax, but also significant increases across the board on all other products, and very fortunately, a new tax on e-cigarettes. At the beginning of this process, well, we were looking through to sort of see what the best practices were. Again, as Marissa had mentioned, given the variety of products on the market, we usually try to push for an ad valorem or percentage of price tax for the other tobacco products categories, just so, all these products come in different packaging, different sizes and things like that, but they all have a price. And so setting a tax based on price is sort of ideal when you're thinking about this broad category. But we were informed that it was sort of difficult to change the tax structure. And so we worked with Herschel and Dr. Henderson and all to adjust the rates based on what they already had. And so, I think that this still shows a very significant increase, which is great. And so, it's not, you have your ideal system and then you have, like a system that will still have an impact. And so this is sort of what we're encouraging them to do. And so fortunately, again, given the original discrepancy in small cigars versus cigarettes, for instance, we were able to encourage them to equalize those tax rates, given that they are often substitutes for each other. Again, increasing the tax rates on other cigars also was significant. And then we also encouraged that they have this sort of catch-all category for other tobacco products, so that anything that wasn't named, so again, specifically smoking tobacco or chew tobacco, things like that, could also be captured at this 22% of the retail price. And again, with the e-cigarettes, we had originally encouraged them to go with the 22% retail price. But given the way that they had structured their tobacco taxes, it was clear that that would be difficult to implement. And so again, it turns out that they had a tax on junk food. And so we sort of used the structure that they had on that to implement this 22% tax on gross receipts. So that's all I have. If you have any specific questions on the tax structure, please let me know. Thanks.
Yeah, that's really, that's such a great visual too, because I think you really do get that sense of how comprehensive this law is, and making sure that all these products are captured as much as possible and are taxed. So as you said, so that people don't end up switching products so that they don't have to pay the tax on those other products that might not have been captured. So that's really great information, and a perfect example, I think, of that, of what I was saying in my introductory remarks about the comprehensive, that's a public health best practice, is to make sure that all these products are captured. And I think also, I had also mentioned in my introductory remarks about the importance of directing tax revenue towards tobacco cessation programs. And so Herschel, I wanted to kind of circle back with you and see if you can tell us more about the revenue stream piece of the law, and how it was important that this law direct that revenue stream toward culturally tailored prevention programs.
Thank you for that question. And just to add on to Anna, thank you for that breakdown on the tax. I really want to credit the Navajo Nation Tax Office, because I think originally in this legislation, we were thinking that they're not going to tax the e-cigarettes or vaping. We were kind of concerned, but then the tax office actually came back with the legislation, the final version, and they actually included in there. So we were so happy and surprised that they actually put it in there, because we thought originally that they weren't going to put it in there. But I really want to credit the tax office for, putting that in there, because we thought they didn't. So I just want to mention that portion. So the tax revenue. So what originally we've always thought, it was, working with our communities, working with our traditional healers, we've always seen that there's a need for advocating for them, for having those population, meaning our traditional healer organizations that are nonprofit on the Navajo Nation. We really wanted to give them some resources or some funding, just as seed funds, for them to, do the work that they do in the community, because that is part of our healthcare system. I consider them to be part of our Navajo Nation healthcare system, that they are, in the community, really helping our people through spiritual practices and ceremonial practices, and then cultural events too as well. But I think through the times that we've been working with them over there, I say over a decade or 2 decades, we always see there is a lack of funding for them. There is one organization that did pass, like an example, they did pass a commercial tobacco policy within their organization, but throughout the years, we see there's no funding to implement that policy. So that's kind of like what we started to see throughout the times we're working with them. And it really showed during COVID too as well. I think there was a lot of need and resources that really didn't get down to the grassroots or to these traditional healer organizations. And I think that kind of really motivate us to really understand, how we could support and really advocate for them too as well. So in this legislation, we earmarked it, 20% of the revenue from the tax legislation will go to traditional healer organizations on the Navajo Nation, and that's nonprofit organizations. And then 80% will go to the Navajo Nation Department of Health, where they'll develop an office called the Traditional Culture and Spiritual Healing Office, which was one of the offices that have been vacant since the Navajo Nation transitioned from a division. Back in 2014, there were a health division. They transitioned to an actual department There was one in office that still has not, started off or hasn't been developed into an actual office. So we felt that the revenue, since we're taxing the commercial tobacco tax, and just the kind of background, it really just went into the general funds of the Navajo Nation. It didn't get earmarked towards any kind of initiatives or anything. So we felt, working with leadership, working with our community people, that we could use these funds, the revenue, to really benefit our nation, to start developing how we look at Department of Health, to really, support them. And really, the essence is really about cultural preservation. If you see the legislation, it actually states that we really want the Navajo Nation to really start thinking about how we could use our own Navajo Nation people's funding to look at, culture preservation efforts in our community too as well. So that's really what the earmark funds and how it's being allocated, working with the Department of Health. So, but thank you for that question, though.
Yeah, and I think it's such an important piece, and sometimes when talking about revenue streams and how to earmark those funds can sometimes be an afterthought, when we're thinking about policies and how to craft them. And this, I think, just again, it serves as a really great example and highlights how important revenue generation is, and then at the same time, making sure that those funds are specifically directed towards these types of programs. So that's really useful and helpful and informative background. So I think just Colin, circling back, I think while we're on the theme of sort of comprehensive provisions, and Anne spoke to this a little bit when she was showing us the slide, but I'm wondering if you could tell us just a little bit more about the importance of those comprehensive definitions and the role that had played in crafting this particular law.
Yeah, I think you'll see that as a theme from all of us talking about this going from the beginning. But I just want to, highlight that comprehensive definitions are really the foundation of an effective and enforceable policy. So that was important and thought about throughout this entire process. As we've all mentioned, the coalition and team at Navajo Nation had been working on this legislation long before it was proposed this past year. But we needed, when they decided to move forward this time, we needed to re-examine the definitions a little bit to ensure that we were capturing the most up-to-date information and ultimately the new products that had been introduced in the interim. So my colleague Mark Meany and I provided some draft language of what we felt was the most comprehensive definitions for the coalition to review. And that really, in a Word document with lots of questions in the margins, we were able to answer, especially the Office of Tax, like Herschel mentioned, their questions about why we consider these best practices to include all of these products. So I think that was really an effective way to work with the Navajo Nation administration through Herschel and Dr. Henderson. But I just want to reiterate that comprehensive definitions are important because they eliminate any ambiguity and make the new law clear and enforceable. And it's really important too for compliance, so that the tribal businesses on the Navajo Nation, any of the enterprises, understand what is taxed and how much is taxed and under what conditions they're taxed. So it really, it also sets the businesses up for success and reduces the any unintentional violations due to vague language that there may be if there was not clear and comprehensive definitions. And it's also really helpful too, as Herschel was talking about, this funding getting earmarked for these really important cultural programs. It helps the Office of Tax track and assess and collect the taxes accurately and making sure that they are going to the appropriate programs. And also, I just wanted to highlight that these comprehensive definitions are really a great example of a tribe exercising their sovereignty and promoting what is best for their community and their people. So ultimately, this legislation, which covers all these products that Anne and Herschel talked about, new and emerging synthetic nicotine, e-cigarettes, pouches, was just a huge victory for Navajo Nation, but also for all of Indian country.
Yeah, absolutely. And that's a really important takeaway. as I see a heart emoji floating across the screen, I think there's agreement across the board about that. I think, and this is sort of an open question to everybody, to each of you, I should say, which is curious about what the lessons learned are in having gone through this process, and either for other tribal nations or for state governments, and what can those jurisdictions employ when it comes to passing these comprehensive policy such as this one. What didn't work? Whatever you can think of, or experience that you've had outside of the Navajo Nation that you can share. So I will throw it out there. Whoever wants to start, you can take yourself off mute. But would love to hear about some of those lessons learned. And I could call on you. You haven't been called on in a while, so I know you had been also involved as well in Indiana, I believe. And but
Yeah.
any wisdom you'd like to impart would be most welcome.
Well, I think thanks for mentioning Indiana. Congratulations to the people who work there. They passed a huge $2 tax increase also. So, between the Navajo Nation and Indiana, I think we're seeing positive signs. But anyway, I think one lesson that I wanted to sort of highlight, I mean, I think the emphasis on coalition is one of the things that we talked about a lot. So drawing upon the knowledge and experience from partners that you're working with is really important. But I also think to not necessarily be defeated feel defeated if you don't pass a tax increase this year or next year. Some of these things take a long time. So for instance, Indiana, we and our partner groups were working there since I think 2015, to sort of lay the groundwork for a tobacco tax increase, which finally, passed this year. And so I think some of these efforts are going to be long-term efforts. And I think that that's an important lesson to remember.
Yeah, and I think, correct me if I'm wrong, but I think in Indiana, there were almost hundreds of organizations involved in a coalition to get that tax increase, which I think was the first one maybe since 2007. Is that?
Yep.
Is that okay?
Exactly.
Yeah. So I think that's such a great point to make, where don't expect this to happen overnight. Because this is something, it's hard enough anyway, as we all know in this world, to get any type of tobacco control measure passed or law or policy passed. And tax in particular can be hard, just because, as I alluded to earlier, that these industry talking points can really be powerful.
Exactly.
Talking about issues like regressivity, they harm low-income households, and that I think lawmakers not as well versed with those talking points can fall for them. And so it does take time, and it does take patience and the work of tens, if not hundreds of people and organizations to really work together to get these types of laws passed. Colin or Herschel, do you want to chime in with any lessons learned based on your experience that you had with this law?
You want to go, Colin?
Sure. Just one quick thing that is a big takeaway for me. Also want to echo what Anne said. It takes time, but we are here to help anyone who is interested in this kind of policy. But I think for tribal communities especially, it's a really big deal. For Indian country, as an example of what a community or tribe wants to or can do to raise money for cultural prevention, public health programs. It's such a good reframing, because we're not talking about it today, but tribes can be prolific retailers of commercial tobacco products, and that's really important for a lot of the tribal communities economically. So this does not get rid of that, but it does generate some revenue for public health programming and specifically cultural programming on Navajo Nation. So I just think that's really important for an important reframe in thought when tribal communities especially are looking at maybe a tax policy.
And Herschel, sorry, Colin.
No, you're good.
No, I was going to say before we turn, we'll give you the last word in the few minutes we have left as you sort of speak to the lessons learned based on what you're going through this experience with the tax law. But I'm also going to throw another question at you, which was that this was passed about 8 months ago now. So could you also just give us an update as well as to how things are going, implementation, timeframe, anything like that, or any hiccups even that that you want to tell us about? That would be
Yeah.
great.
Okay. Yeah. Thanks for the question. Just to kind of piggyback Anna and Colin, that it really does take time, to be honest. And this took, like I mentioned, I think 2011 was the first time the Team Navajo introduced the tax legislation. Then we reintroduce it. We wanted to introduce another one in 2016, 15, but we just picked it up in 2024 again. So I think it does take a lot of time, patience, and really just understanding when's the time, when it's a perfect timing. I don't think there is really a perfect timing, but I think it's just really just understanding who you're working with and your administration and the grassroots efforts too as well. But I think what I learned through this process is that, going to our traditional healer organizations, I think we got about 8 organizations on the Navajo Nation that really supported this through either a supporting resolution or a supporting letter. And just going to these organizations and really bringing this awareness about how, the difference between commercial tobacco and ceremonial tobacco, like even that is still being a process of educating our people. But I think through these tax legislations, understanding what we're doing, I think they understand a little more in regards to what we're trying to do to really advocate to reclaim something that the tobacco industry has taken away from us as Indigenous people and as Navajo people, that we don't want these types of products being sold in our communities. And specifically, we don't want them to be used in our ceremonies, in our cultural settings, in our environment, in those areas. So I think that what I'm learning is that they're more understanding of what we do as a public health people and our outside, internal, I guess, partners that we work with. They understand that we're in the interest to help them. We're in interest to help our nation and interest to help our culture. And we're not there to try to exploit them in any way, but we're there to help and support them and throughout this process. And I think it really brought our coalition and our organization really closer to a lot of these traditional healer organizations and the work that we do in public health too as well. So that would be my answer. I was trying kind of long, but the implementation. Okay, so the implementation you mentioned in October. Yeah, so right now we're working with our sponsor, our main sponsor was Delegate Carl Slater. What we understand is that they are asking for an extension to the implementation. I think it was 6 months after October it was supposed to be implemented. But due to the process of how the tax office, working with retailers, a little more language that needs to be kind of defined and how they, expedite the implementation of that, it's going to take a longer process. So they are going to introduce another legislation to extend it for another 6 months, is what I last heard. I think it's going to be probably sometimes in fall time, maybe even winter time, that they're going to be implemented fully. And so it's just really trying to work with the tax office and the Department of Health and see how they look at the time frame and the implementation process, which is okay. We're open to working with them, and it is a government entities. They do work a little bit at a different pace than compared to what our expectations are at the grassroots or our coalitions. So we're just working with them, but we are working with the Department of Health to see how the office could be implemented, working with our coalition to really try to bring our culture people, our traditional practitioners, expertise in different areas to really see how that office could be developed, how it could be implemented. So there's a whole process to it as well. So I don't think it's going to be done anytime soon, but it's just, it's still on our radar. We're still going to help and support wherever we go or however we could help them. We're going to be right there with the Navajo Nation government to support them as well. So not sure how the time frame is, but we're looking maybe, hopefully by winter time, there'll be an actual date set for when the implementation will go into effect.
Thank you. That's really helpful. And again, kind of goes back to I think, oh yeah. So Stephanie, yeah, do you want to, Herschel, do you want to just highlight some of these features on your
Yeah,
slide?
if you guys want more information, here's our website. We have www.navajoeraslife.com. There's a lot of more information on there in regards to the legislation and just the work that we do on Navajo Nation. You'll see a lot of, we're still updating it too as well. But that's the information if anybody would like to know a lot more or know a little more information on what we do.
Wonderful. Thank you so much. And I think we'll wrap up where we started, which is that the tobacco industry knows that high taxes and comprehensive tax policies work really, really well for public health and hurts their business. So let's keep doing this great work and hopefully continue the momentum that started within the Navajo Nation and with getting this landmark legislation passed. And congratulations to all of those who were involved in that process. It really is a significant victory. Thank you so much to Herschel, Ann, and Colin. I know I speak for everyone here at the Public Health Law Center that we're always grateful for our partnerships with you and your organizations, and look forward to doing more great work and tobacco control in the future. Thank you, everybody, for joining us. We'll see you next time. Thanks.
Thank you.
Thank you.
Everyone.